Hello, everyone. This is Omar Ghanem. First, I want to thank the SAGES committees for inviting me to be part of this panel. My topic today is going to be Facebook as a tool for surgeons or as a forum for surgeons. I have no disclosures. There's going to be a lot of personal experience here and background so that you know how I got involved in Facebook groups. In 2017, I was graduating from one of the most prestigious institutions in healthcare around the globe. And I wanted to stay involved in research and connecting with other colleagues in surgical education. But unfortunately, I was limited by somehow by my visa status because I had to be in a rural area, mostly in a community hospital. So that made things a bit harder. I was trying to find ways to keep connection with other surgeons and colleagues. Traditionally, collaboration was mostly through conferences where surgeons go from one state to another and from one conference to another, try to acquire knowledge, new techniques, and share their data. However, that has its own limitations, being away from family, a lot of travel cost, and also, as you can imagine, not all conferences are always full capacity and they all have their own limitations. The other way of collaboration was to travel through to a large institute where you can shadow a pioneer in a certain procedure, be with them for a week, and then go back to your practice and try to apply what you learned. But those pioneers are not always accessible for you to be able to ask them questions or to review the videos with them or stuff like that. So also this way of collaboration has its own limitations as well. Added to the fact that you are also away from your family. Surgical education is best defined by Dr. Fried, who says surgical education is to come up with a structured way that can ensure that each individual surgeon is fully and properly educated to develop the knowledge, skills, and judgment that are required to take care of a surgical patient, often in a time-limited environment. It has many contributories to it, and evaluation, patient outcomes, sense of community, technology, communication are all part of it. The question is the current surgical education model, does it satisfy all these criteria? And is there a need to redefine surgical education? The new complementary method should be readily available, protect privacy concerns through closed groups, allows communication and share of information, techniques, and videos to be cheap, and that it should not take much time away from family. The only social media platform that can satisfy this, in fact, is Facebook. And Dr. Brian Jacobs saw that in 2012 and started what we call a closed group, International Hernia Collaboration. He started that in 2012. And how do these groups work? If you see, this is a live Facebook page. Surgeons here posting a certain technique for a hernia repair or sharing a CT scan and asking, what would you do in such a patient? Or even like here a surgeon from India, Dr. Ramana, is putting like an article and it turns into mostly into like a journal club. And David Soibel, who wrote that article, is able to communicate as well. This is from the International Bariatric Club. This is a post about the Omega trial. And you can see here bypass versus mini gastric bypass. 208 comments over a period of a year with names like Michel Garnier, Mahawa, Ali Aminian, Mayo Musala, all names that are really prominent in the field, giving their opinion back and forth with other surgeons contributing and giving their opinion or their point of view as well. This again, 208 comments over a period of a year kept going back and forth, so it served more as a journal club and sharing of ideas. Another way is for example, here, Dr. Igor Belyansky popularized the ETAP through IHC and international area collaboration, and many surgeons learned that through his videos here or visited him in Maryland. He was able to collaborate with all of them or with most of them, and then bring up a paper, which is the ETAP technique first published as a global thing through surgical endoscopy. And you can see here, Victor Radu is saying that he picked this up on IHC and he picked it up by Igor. So these Facebook groups really are a good source of teaching. Now the IHC has 9,825 members and this has inspired many other surgical societies or groups to be built. SAGES itself has 80 groups in the different topics, hernia, foregut, bariatric, etc. So how was I involved? I was very impressed with Eric Pauli's ability in reading images and hernias. So I said, maybe we should teach everyone through that. And I contacted Brian Jacob and let's do a lecture series. And he thought it's a great idea. So Dr. Pauli came up and posted a 75-minute video about reading scans. And then the next day he came up live on Facebook Live and got questions for 1 hour and a half from all the audience in IHC and the members. This was a great success, so we introduced CME to it as well. And we did 9 lectures total on different topics by different pioneers all around the world, Colombia, India, Mexico, and the US. And those 9 lectures, we were able to publish this as a first CME Facebook publication. And SAGES itself started also adopting this kind of model. These groups are being monitored, they are being audited. This is a publication in Surgical Endoscopy 2019 by a group in Houston. And they discovered that social media, such as IHC, can be a useful method for surgeons to communicate challenging problems and an important educational tool. Facebook saw the benefit of that, saw how good these groups are, and partnered with IHC, and they did kind of a mentorship program where a mentor is connected to a mentee over a length period of 8 weeks to share knowledge and to teach him or her things through Facebook. Other societies saw the benefit as well. America's Hernia Society reached out to IHC and they started giving some of their lectures through the IHC just because of the wide reach and the audience and the ability to interact back and forth. Myself, I was super impressed with, again, the reach and how much people you can affect with these posts. So I reached out to Thomas Rugula and the International Bariatric Club, and I started the IBC newsletter with different interviews with different surgeons, debates, case of the month, and these were published on the International Bariatric Club Facebook group page, where they serve more like a journal club with comments back and forth. Multiple posts or post types can be present, polls, educational posts, live operating room streaming, sharing a challenging case, I need help, what would you do, a new technique, managing complications, stuff like that. This is a case, just to give you ideas of what gets posted. This is a case that I posted, a patient that has an upper midline huge ventral hernia. You can see here, I'm trying to reduce the hernia, but the background of this, I posted a post with a CT scan, BMI 48, trying to see how can I get her to lose weight and optimize her before hernia repair. And I got multiple opinions. I had something in mind, but I wanted to see if someone has an opinion. Someone said, beware of having a distal obstruction and a proximal leak. So I knew I had to address that hernia at the same time, especially that the port sites were in the upper midline. I'm reducing all the contents, as you can see here, and most of the abdominal contents were really in the hernia rather than in the abdomen, removing everything, and then I did a sleeve, and I was able to post afterwards the outcomes and how the patient did, and people knew that I excised the sac here in an open fashion after I finished the laparoscopic sleeve and sutured it primarily, and people were able to check the outcomes. As you can see here, about 250 interactions with this post. Another post is like, what would I do? This is a patient that I have myself, a retracted ostomy and macerated skin. We couldn't get control of this ostomy. You can see the ostomy is going through the hernia itself. I posted this on IHC. Yuri Novitsky saw this and contacted me. He said, just put a esophageal stent. I said, well, I've never done it. He said, it works. And here we are. I'm posting also the what would I do, and then the outcome, and surgeons are able to see that this worked well and they maybe can use it in the future. Here is a challenging case that was posted also on social media, a GE junction gist tumor. I asked everybody what would they do in this. This is more of a new technique. As you can see here, the gist is next to the GE junction, and everybody suggested like gastric ports, but I found that this is an easier way. So I opened the stomach, and here I'm suturing back the stomach. And again, doctors like Ponsky or Felix were pretty much really praising this approach and really confirming that this lady or this patient got the right treatment. SAGES as well, we did on the SAGES Bariatric Facebook group through the committee with Dr. Kro and Dr. Farah Hussein. We did what we call a Facebook challenge. Here I am with a post on GJ challenge. So this started in the pandemic. We wanted to keep the education going, especially with the conferences being canceled. So we started that. This was the first video where I posted a GJ, a hands-on GJ, and then asked for critiques and comments and what would the other surgeons do. This was unedited at the time, and the surgeons were able to give light feedback and then post themselves their technique and really learn from others, and at the same time teach others of why would I apply this technique here and there. Multiple posts, linear, hand-sewn, linear stapler, circular stapler, robotic laparoscopic, everything. And then afterwards, we were able to do a webinar that included or represented all the groups or the techniques that were there. It was really a great success with more than 80 surgeons tuning online on Facebook at the time of the webinar. And this is again proves that Facebook is a great tool for surgeons. These are all vetted members in all the groups where you have to prove that you're in healthcare or you're a surgeon or this or that. We continued with the webinar, and this is another webinar also on the SAGES Bariatric Facebook group with 9 or 8 prominent figures all giving their opinion about ICG. We did submit for publication, Sal Decimo, Brian Jacob, and myself, the closed groups during COVID area. And also most SAGES groups were really show a very big spike in the comments and posts. So this was a great alternative. At this point, we don't have a choice if we're going to do social media or not. It's how well we do it. And this slide shows that the future is social media, not off social media in medicine. In fact, if we're talking about future surgical rounds to be like this, surely social media and internet is involved. This summarizes it all. This is me sitting with my daughter, watching surgical videos at home, at my comfort level, through these SAGES Facebook groups. How better can it get? Can it get better than that? Thank you so much, and I hope you enjoy it.